Good evening, all participants. It is my pleasure to welcome you all. Good evening, participants. It is my pleasure to welcome you all to AICTE Training and Learning Academy sponsored faculty development program on leveraging machine learning and data science in healthcare and medtech. This program, spanning from January 6 to January 11, 2025, promises to be an enlightening journey into transformative power of technology in healthcare. Now, we are moving to our first technical session of day 2, which will be conducted by Dr. Manish Kurekar. Dr. Manish Kurekar is currently serving as head of the Department of Computer Science and Engineering at Visvesvaraya National Institute of Technology, VNIT, Nagpur. Prior to this, he held key positions at esteemed organizations including Persistent System Limited, Nagpur, IBM India Research Lab, New Delhi, and Texas Instruments, Bangalore. Dr. Manish Kurekar holds a PhD in Computer Science from VNIT Nagpur and MTech in Computer Science from IIT Bombay, Mumbai, and BE in Computer Science from VNIT Nagpur. He has total 21 years of academics and industrial experience. A renowned research and academician, Dr. Manish Kurekar has published 12 research papers in SCI, SCIC journals, and 14 conferences papers. He is also the holder of 3 international patents. Additionally, he has successfully completed 5 consultancy projects worth approximately 1.5 crores and is currently guiding 2 ongoing and 2 completed PhD students. Welcome, sir. Now I request Dr. Manish Kurekar, sir, to share their valuable insights with us. I am going to hand over this session to him.
Thank you for the kind introduction. And let me share the screen now. Are
Hello,
you able to see?
Saira madam. Yes, sir, your screen is visible.
Hello, yes, sir. The PPT is also visible and you are audible.
Okay, thank you. So let's start. Uh,
Okay, sir.
okay, thank you. So today's topic is basically regarding the healthcare data and what are the typical sources and challenges in acquiring and using this healthcare data. So we are trying to find out what are the things are there in that might be useful for our healthcare usage of our healthcare data. So let me start with this. So this presentation will delve into significance, various types, primary sources, and key challenges that are considering the healthcare data in today's healthcare environment. The thing is that a lot of this data requires us to this data is shrouded in mystery. The reason is that there is a lot of privacy and ethical concerns regarding the human medical data. Because what has been observed in the past is that if you come to know about the human information or data, what happens is that it typically results in ostracizing those citizens or those people and people tend to keep a distance or don't see or don't want to communicate or don't want to have any physical social relations or sharing of objects or so with such people. So that's why these data typically is kept very, very private. And there are a lot of ethical and concerns regarding sharing this data. And if any hospital or any clinic is found to be sharing is violation of this data privacy, their license to practice can be cancelled. And because of this, what we see is that there is a huge problem in sharing the data, even the anonymized data, right? And like we are seeing currently, the virus that is being reported, like today only Nagpur reported two virus of HPMV or something like that. And we see that so people who are having this virus would be ostracized or would be isolated. Their parents, their families might get isolated. So we see that there is having an information might create panic, and having no information also creates panic. So healthcare data is very, very strange and very, very we can say we have to handle it very carefully. And that is the reason we see that the authorities have very strict guidelines regarding sharing and informing this data. And that is the reason we see that acquiring this healthcare data, the storage of this healthcare data is not very standardized like we have in other domains. So if you see the data that is being stored for other domains happens to be very, very nicely put. And so we can run queries, we can find out details, we can analyze that data, and we can find very quick results. And that is not possible with the healthcare environment. And so today, what we are going to do is that we are going to look into what kind of typical sources of this data are, and how this data differs from our regular data, and what can be done for this, and how to do research in this area. Okay. So what is this healthcare data about? So we see that there is a lot of data regarding investigations. So investigations meaning like we have different types of investigations. So some are like which can be done without any invasive thing, like for example, blood pressure is a non-invasive thing. Temperature is a non-invasive thing. You can basically sense it, this data, without actually piercing the body or taking something from the body. Then there are elements like blood sugar, or rather, a lot of these elements which we get from blood. It can be sodium concentration, it can be creatinine, it can be like the regular blood counts, red blood corpuscles, white blood corpuscles. So this is basically an invasive thing. And then there are data that is basically not text based but image based. For example, different scans, we have MRI scans, X-rays, and other things. And so there are various types of data which basically can come in the data which is found from investigations. Then there is administrative data, like when the patient was admitted, when he was last checked, how much time did he take the prescriptive medication, right? Who was the doctor who was seeing him last, and who is the current doctor? Which injections were given at what time? So time, date, place, movements inside and outside hospitals and clinics. So, and also payment procedures like insurance. If some people might be paying from insurance and other things, or co-pay will be there. So a lot of such administrative details are there. And obviously, financials will have a lot of financial data, like how much medicines were purchased, at what price, whether there was any discount given, what kind of procedures were done, which places, and so on. So a lot of such financial data is there. Then there is prescriptions data, like what was prescribed, like whether medicines were prescribed, where exercise was prescribed, whether any prosthetics, like or say bandages or other things were prescribed. So a lot of prescription data is there, and prescriptions might change from time to time depending on the vitals of the body. And obviously, there might be some prior history, some other things like the person might be on some other medications. There might be some accident before, or the person might be having some habit, uh, which might result into certain conditions. So basically, if a person is working, let's say, in a job where he or she needs to sit for 8 to 10 hours, then that person might develop, say, backache or neck ache and so on. So there is a prior history associated. It might be a short-term history, a point level history, like this person had an accident and because of which these problems have occurred, or because this person has been sitting for 8 10 hours for last 5 years on the same chair, and that's why there is a swelling on the neck and so on. So it might be a lifestyle related thing, or sedentary lifestyle for many many years has resulted into certain diseases. So there might be prior history because of that, or even a history which involves forefathers, like there is a history of glucose running in the sugar problem running in the families, or there might be we can say something like blood pressure running in the families, and or might be carrying certain genetic mutations. So in our part of the country, we see that sickle cell anemia is a genetic mutation which is carried by a lot of females and males. And if one female and one female both have this genetic mutation, it pass to offspring, then the offspring has basically may have, if the other gene is also like X and Y is there or X and X is there, and if the other gene also has the same mutation, then it results in sickle cell anemia. So we see that such kind of genetic history may also be there. So there are various kinds of histories, and so all of these basically comprise of the healthcare data. Okay, and obviously the regular features like age, height, weight, and so on also become part of the healthcare data. Right. So where this is stored, typically we will require electronic health records. So electronic health records and medical health records are two key types of healthcare data that have fundamentally transformed how healthcare providers manage the patient information. So um, currently, there have been some standards which have been evolving around this, and there have been some amount of prescriptions that have happened, and a lot of such type of data is now formally being collected and formally being stored. So basically, this EMR, electronic medical record, refers to the digital version of patient's paper chart in clinician's office. So basically, medical and treatment history within one office, one doctor's office. Okay. Whereas the electronic health record takes the concept a step further by having a more comprehensive and holistic view of a patient's health. So the health records are designed to share information with other healthcare providers and organizations, which can be laboratories or other specialists or medical imaging facilities or pharmacies and so on. And like if you are getting transferred from one hospital to another, say a primary healthcare to a tertiary healthcare facility, and you want to have this data being made available, Then currently the practice is that we carry all the papers and there are other things. But for people taking a treatment for longer time, this becomes a big thick file, and many a times the critical pages are not visible or they are not found, or we just forget to show them, or there are multiple files, we take only two files out of five files that we have, and so on and so forth. So this uh, electronic health records can have prioritization, they can have a sequencing, they will have definitely a history, and so on. So this is a comprehensive thing which can be shared with others, so that this whole thing becomes more manageable. Then we have the administrative data that is typically generated each time a patient has an interaction with the healthcare system. Okay, so it can be visit to a doctor's office, or can be basically to a diagnostic facility, or admission inside an hospital, or basically home care facilities, and so on, or even pharmaceutical. Um, so this data can is gathered for administrative and billing reasons, but it can be analyzed to find out the frequency of visits, the reasons for visits, and the satisfaction survey uh, that can be done. You can found out what people prefer. For example, currently we have pharmacies which basically provide generic medicine. So generic medicines typically have the molecule name; they don't have the brand name. Okay, so for example, we have like uh, if we have fever, then instead of taking the medicine which is having like the brand name associated with it, like Dolo, we can just take the formula or the salt that is contained here, and the cost rapidly falls. So we see that there are many cost effective companies which can manufacture the same molecule at a fraction of a cost. So we can figure out where are these people going for purchasing the medicine, why they are going there, and so on. Then we have, if nowadays the awareness of medical insurance has been increasing. Also, many facilities like the many institutions, many governments provide insurance facilities. Group insurance is there. People also purchase medical insurance, and there are many other facilities like government has facility like all people over 70 are insured, and they can go to selected number of hospitals where they can be treated without any cost to the patient. So so basically, this claims data has billable interaction with the patients and healthcare delivery system for coverage, compensation, and this can be used for diagnosis and finding out what kind of treatments were required, what was the cost, where was the service rendered, and so on. And this can be used for multiple things like tailoring the insurance policies, costing it properly, so that so insurance companies are also for benefit of themselves. They are not for philanthropy. So they are also the exist to make profit. So how do they can tailor so that the policy is good so that patients will take it. It is not exorbitantly priced or it is not unfairly priced, but also it is fair to all. It is it also makes some money for the insurance company. So all such things are there. So then there are patient disease registries. So um, so patients may have long-term diseases, like the examples given here, like Alzheimer's, cancer, diabetes, hearts disease, asthma. So these basically are chronic conditions. Chronic meaning that run for several years, and many times these conditions have to be managed rather than cured. So it gets cured many times, but sometimes you just have to, like BP, sugar. You see that you are on lifelong medications. So what affects this? So what increases the BP? What increases the sugar levels? Okay, so you can avoid that, doing that, or you can avoid eating that. So all these things can, or you might be like having allergy for a certain compound or a certain environment. Like some people have allergies for dust. Some people might have allergy for certain chemicals. So there is milk allergy, there is nuts allergy, so there are allergies of different kinds, and so these allergies can be classified, or can be, we can say, can be registered into the system, where these registries can be used for tracking the patient. And so every time that patient doesn't have to inform everyone about what is happening, what diseases that person has, and so on. And this might be essential if, let's say, in a workplace, the patient passes out and now he is admitted and nobody is there. So to provide the first aid and from the family. And at that time, if such a registry is there, it becomes very helpful. Then there are health surveys. There are many surveys that are carried out across the country for the prevalence of different diseases. For example, during monsoon season, the surveys of dengue and chikungunya was carried out, and then the central healthcare team from AIMS Delhi, decided to visit Nagpur for the prevalence of chikungunya and dengue. And that is possible because they keep on collecting data, finding out information, and finding out where to intervene, or why is this happening. And that helps in decision making and formulating the health plans and epidemiological status and health patterns. Maybe certain things are prescribed, certain things are reduced. In Corona, for example, pandemic, we had several prescriptions made for reducing the. So there were a lot of interventions decided because of this effectiveness of the finding out the effectiveness of this. It was done basically. You do some intervention through surveys, find out what this municipality did, what that municipality did, what things worked, what things did not, and that can be collected, and those can be analyzed to find out what happens. Then there is another type of data which is very important. This is the clinical trial data. So clinical trial data is basically based on an experimental medicine. So in medicine which is not currently available in
Sir,
the
you are not
market,
audible, sir.
how this medicine is working, what are the things this
Sir, you are not audible, sir, properly. I think the network is not working.
medicine does, and
Hello, hello, Dr. Manish, sir.
how this medicine affects the patients. So typically, what happens
Sir, your voice is not audible, sir.
is that uh, so so uh, are you able to see my screen and hear me?
Yes, sir. Now you are audible and your screen is visible.
Okay. Okay, I think we all got logged out. Okay. So I'll start with this. So clinical trials are just to rephrase that. I don't know where we lost everyone. So Ashwini Lokhande and Dinesh Yadav have raised their hands. So you can ask the question. That's fine. Do you have any questions?
Participants
Sir,
can
we will
ask
take
their
the question
questions in
over.
group chat.
Sir, we will take the questions at end of the
Yeah,
session.
but if
You
people are
can
raising
continue with
hands, so I
your.
was just wondering. Yeah. Okay, fine. So we'll go ahead. So, clinical trial data are basically done by pharmaceutical companies prior to the introducing the drugs to the market. So the clinical data trials are done on patients and their response to the drug, whether it is effective, not effective, how much it is effective is recorded. And if it is found effective, then it is basically made available to all. So what we see here is that the this data typically is provided. So this is a very secret data because every company wants to keep this data information very secret, but it has to be provided to the approval committees, and they run different analysis on this, and sometimes educational institutions are also shared this data for the processing. Then the next type of data is basically the genomic data. And the genomic data nowadays is people are finding it quite useful to detect information about what might, we can say, what kind of genetic makeup they have, so that they can take certain preventive measures. So if they have certain mutations and that mutations may result into certain disease later, then people can start taking the precautions previously, before itself. The other things they are able to find out from this genomic data is like long lost relatives. If you want to, if you have the similar kind of genetic makeup, then you may be related in certain ways. So this is also used to find out paternity tests in many kind of connected things. So this involves the sequencing of the genes and storing the DNA information, the genes information, and this can be also used for analysis, statistical data analysis, and finding out what kind of mutations a particular thing has, or if you have seen, this is used for finding out the where did the humans originate, how did they populate the earth, and how the initial migration, say 10,000, 15,000 years back happened. So this genomic data is also available. So, what are the different considerations? We have just seen there are different types of healthcare data that is available, and obviously this is available, but it is not, we can say, publicly available. So we have to make efforts to get this data. There is what is the importance in modern medicine? Basically, the accurate data analysis improves the patient outcomes and supports the evidence based medicine. So, if you basically have exact information, then you can have personalized medicines. There is a lot of privacy and security concerns regarding this, because if the confidentiality not maintained, then people might use this data to ostracize or basically have discrimination against a certain group of people or certain persons. Then quality issues are extremely there, because the focus always, whenever you see a patient, the doctor and the healthcare facilities, the focus is on improving the health of the person. The focus is not collection of data. So there might be inaccuracies, there might be incompleteness, there might be empty things left out just because there was no time to record these things. And this might lead to poor decision making. Obviously, there are different sources of healthcare data, hospitals, clinics, and so on and so forth. Because this data is now stored by different entities in different ways, the softwares are developed by different people, different companies. There is no consistency, like you can't fair, readily mix this data and have a consistent view. And also there might be a lot of duplication issues also, because you are having the same thing recorded at multiple places. Then there are many regulatory compliances. So, for example, in US, there is a compliance called as HIPAA, and this HIPAA compliance. So, every healthcare provider needs to make sure that the data collection, storage, dissemination is HIPAA compliant, and there are entities which basically will come and analyze your information setup and certify that whether it is HIPAA compliant or there are any lacunas that have to correct the next time. And obviously, this data collection is now improving, and because of the data collection is improving, we have better analysis, and the better analysis enabling better healthcare delivery. So, what we have seen till now, the importance of healthcare data because it improves the patient care quality, which because of the informed decision making, it in better healthcare policy decisions. So, the government can using this healthcare data can have better policy decisions. For example, so this current HPMV virus, I don't remember the short form also, but this virus is found on children which don't have any travel history, or even their relatives, near relatives also don't have any travel history. So that means that this virus has traveled from certain countries to India, and it has spread to people, even children, uh, who are unconnected with any travelers or directly not connected with any travelers. So it means that this virus has spread so far and wide that it has affected those children who are unconnected with those travelers. That means that now putting an intervention anything is probably not going to contain the virus. But the silver side of this news is also that probably people in India are already immune to this virus, so that we are not seeing mass level of hospitals being like overwhelmed with the patients with HPMV. So probably this virus is, this is very initial stages. I'm not any authority on commenting on this, but just whatever we are seeing or hearing from our health minister, it's not an alarming situation as of now for India. So so the policy decisions are driven by this kind of information gathering, and so the healthcare data also supports clinical research, and which drives the medical advancements and treatments, and obviously operational efficiencies. So if we see that certain procedures are unnecessary, or certain uh, so for example, in corona, initially it was said that taking a chest x-ray is required, or CT scan is required to find out the extent of corona damage done to the lungs. But it was later found out that initially stages, even day one or day two of corona, you typically don't have much lung damage. So lung damage actually happens after fifth, sixth, seventh day. So if you just rush immediately, you are found out you are corona positive and go and take a X-ray, it's not going to help. So initially advisory was that you do your chest scan immediately and find out how much damage is there and so on. But that was withdrawn, and only for cases which result in fever of after fourth or fifth day, then you do a chest scan. That was issued. So that resulted in saving so many people's money and so many people's anxiety about getting themselves tested right away, immediately after you are diagnosed with the coronavirus. So this data analysis that improves the operational efficiency, and which improves the uh, healthcare efficiency. So, what are the diverse categories of healthcare data? We have seen that the healthcare data is like we can have structured data. So, where everything is properly marked and so, like for example, when we do entry into the hospital, we have name, address, all fields are separate, phone number, email, and so on and so forth. So this is very nicely organized. You can find out the name and so on, and it typically will get printed on the any sheet that hospital gives you. Then there is unstructured data. So typically the doctor will come and visit, and he will write prescription and other things, um, and which for an untrained eye, most of the doctor's handwriting is not even legible also. So, so we see that this is totally unstructured data. We cannot analyze this right away. We cannot digitize this right away also. And this also may include images and videos, which cannot be quickly analyzed, right? So then we have semi-structured data, which provides some structured things but some unstructured things. So an X-ray might be labeled with the patient name, the time, and other things, which can be a text and nicely arranged. But this X-ray is for what? That may not be there. Okay, so it's a semi-structured data. So, so if we try to understand the structured data, is like we have fixed fields, it facilitates easy record management, and it might have nice billing codes, nice electronics health records, and so it is easier to analyze, process, store, and this this is the best kind of data that we can get. But it also requires time and efforts to keep this data clean, nice, and entered into structure digitally. The unstructured data is basically nothing, no formats. It becomes very difficult to analyze and interpret, and so the doctor's prescription, the clinical notes, and images, they form the part of unstructured data. And now then you have to use a lot of specialized tools for extracting the text or the contents, and so that this data can be transferred in some form to a structured one, and so that it can be analyzed. So it doesn't remain just a blob of text or data or image. It can be parsed and figured out what this means. And obviously, the semi-structured data is that doesn't have a fixed structures but have some markers for data elements or some tags, and it might be in certain formats like XML or JSON. So you have tags. So this the next whatever is follows the description of the disease, uh, and but that description might be 2 lines for one patient and 50 lines for other patient. So it is semi-structured. So you can figure out certain things, but not everything. And again, it basically, or it might be generated from the unstructured data. So this is one of the most common kind of data that is found in healthcare. Obviously, we have seen that the data can come from health records or imaging, and now a lot of this data is getting from fitness trackers and smartwatches that provide continuous health monitoring and data collection. So this is a new entrant into the things, and this also is tracked with location and other things, so people know how much height they have climbed or which sport they have played. So those are also part of the wearable devices, and which makes more like data analysis easier to figure out what how the body reacts to certain conditions, to certain we can say exercises and so on. And patient, because of the social media, there are a lot of Patients who give a lot of information about the use of the medicines. Like if you go to like any of these websites like 1mg.com or say any other direct pharmacy like online pharmacy, you'll see that under every medicine the patients have given a lot of feedback about that medicine, whether it works, whether it doesn't work, what kind of conditions it works, where the severity was reduced, whether it was reduced in 5 days or 7 days or 2 weeks, or it never worked, or it there was repeat medication required. So many of these things. Informal surveys are there on many social media sites or even this thing. So we can see that this data is available in multiple places in multiple ways. And so obviously, so we have already talked about electronic health records and we have talked about its features, benefits. The only two things that come to the barriers are basically high implementation cost and data breaches. So the implementation costs are actually very high because it's a it needs to be created at the same time this whole thing is getting implemented. In the sense that when the patient is getting treated at the same time, you have to enter this data. If you delay it, you might lose the data or this data may not be relevant at all. So, having this online person always available to record the data is very, very costly. Typically, if the data can be collected and digitized in offline manner, so in the sense that the patient comes, all these things are done, the patient goes, and then this data person comes in the morning 9 o'clock and 5 o'clock, and he till 5 o'clock he records everything that happened yesterday. That is the ideal situation, but that never materializes because you need the patient, you need the data, you need everything right away so that you can record it then and there. And the delay basically removes the liveness of that data. So but then if you have three persons working in three different shifts to just record the data is very, very costly. So we see that the implementation cost, the data collection, recording itself is a very, very costly thing. And so, for example, we have five actually institutes of public health in India, and they have very nice problems to solve. They have a lot of data also, but this getting additional data or additional information is so costly that many of the projects just don't get off the ground just because there is not enough data collection people or data collection that has happened. And data collection, digitization in a proper format, error free, is a very costly business and it has a high implementation cost. And once you do that, the next thing comes is the risk of data breaches. Breaches meaning, so some hacker might just store this s- data, make it available on the web for a cost, and everything is lost. So we see that this data breaches is a very, very costly thing. And so anyone who collects this data has to have this privacy and security built in into the system, and encryption of this data has to happen, anonymization should happen. Even if the data gets breached, you should not be able to connect the data with the patients or with the people with the faces. So that has to be and everything involves a huge cost. And that is very, very severe kind of challenge, big challenge in electronic health records. Obviously, wearable technology is now new. It basically gives the real time health data collection like heart rate and activity levels and so on. And we have seen like there are many inbuilt things in say You've seen the Apple Watch directly dialing in the emergency services if it detects irregular heartbeats, or say if detects the heart attack happening, or such things like that. So we are seeing such kind of interventions the devices themselves doing, and it has become reality now that there is a 24 cross 7 check on certain things, not everything, but on certain things that can be done by wearing a particular device. And many things are getting smarter by the day. And Fitbit and Apple Watch typically lead the market in health tracking technology. And obviously, this technology is also promote the personal health management. People can track their how they are sleeping, how much they are sleeping, how much they are exercising, how much steps they are taking in a day, and they can tailor their exposure to different activities or different exercises based on the feedback that they receive. And obviously, they have empowered people to take charge of their life, to make changes to themselves. Okay, so uh, the major challenges to this healthcare data management is basically the data privacy. We need to be sensitive to patient information. Interoperability, in the sense that if a patient moves from one healthcare facility to another, one doctor to another, from doctor to clinician to lab, everything should be shared, should not be a significant hurdle. And people typically travel between countries or states, so they should be able to change the things and without any problem. Data quality, as we discussed, it is very costly to have accurate, complete healthcare data, and human capital needs to be invested to collect that. And sometimes there is a data overload also. If the data is too huge, how can you uh, analyze that data? Let's say if your Fitbit is collecting data of blood pressure for several years now, and you'll see that this data is huge. How do you analyze? How do you do benchmarking? Is are two individuals having the same blood pressure is fine? Is it fine? So medical literature says that some people may have higher blood pressure by default. So if the person has higher blood pressure for a long time, is it blood pressure, that person has a blood pressure, or that person has a higher blood pressure by default? So there are many questions to be answered, and just having data doesn't solve it. There needs to be a human in the loop. We need to have doctors who can analyze the data. But if a doctor is presented with the data which is for last 5 years, it will be overwhelming. So we need to have some policies of how do you process, how do you analyze these vast amounts of data. So coming to data privacy, uh, so patients should be confident in going to a doctor or health facility and sharing the data. So obviously, this data privacy is important. We need to have key regulations uh, implemented, and HIPAA is one such for US, but there are regulations in Europe, separate regulations in India for data privacy, and not only for medical data, it is for all digital data. Uh, So security measures have to be implemented so that no unauthorized access happens to this data. And obviously, the staff needs to be trained, because staff has access to the internal data. They should not maliciously or unknowingly leak or get some internal data outside. So that needs to be maintained, and regular audits have to be done for maintaining the compliance and protection of the uh, medical data. Uh, so obviously, as we talked about the ethics and morals and complications of uh, data sharing, There is no standardization that has happened because there are a lot of barriers to these standardizations. And so there is a lot of inconsistencies that happen if you want to share the data because standardization is not there. So we see that when the standardization comes in, we generally are able to share or change or exchange things. So if we see that if our tube light doesn't work, we can just replace it with another tube light because they are all standard. Um, so if we see we can, if our charger of the phone doesn't work, we can just buy in another charger and put it in a phone because all the more or less all the Android phones have the same charger, but you cannot put in for an Apple same charger to an Apple device because it works on a different charger and has a different socket. So we see that if there is standardization, there is interoperability. But if the standards are not followed, then there is no interoperability. You have to buy the same thing or go to the same doctor or same hospital because there is no information that can be made available to others. So then otherwise you will have to like somehow carry all the printouts, files, Xerox, and take it to the other medical provider if you want to share the data. So there is a lot of standardization. There is high integration cost because people need to find out if data is being shared, whether it is shared properly. Like the name is going into the name field and name is not going into the address field. Disease is not going to the name field and so on. So interoperability requires a lot of human intervention, which is a very costly operation because all these are highly paid individuals and that increases the cost like anything. And obviously, patient information is fragmented, it is not complete, and that increases the cost. So, so this is a research problem. How do you ensure data integrity in healthcare? How do you automatically find out what is data quality? How the data, what quality data is being made available? How do you do regular data validations, saying that this data is accurate, reliable, complete? How do you do that? How do you do audits of this data? Okay. So these are all research problems in the sense that anything significant that simplifies this whole thing, that removes the hurdles of data sharing, that brings down the costs of data, identifying data quality issues or data validation issues. How do you do audits, automatic audits of this data? Or even staff training initiatives, videos that can train the staff. So that is all research issues. And obviously, people are trying to solve these problems, and there is a lot of money in these initiatives, and a lot of initiatives, a lot of projects that are some of them are funded by the government, some of them are funded by the various consortiums, some of them funded by the industry itself, are trying to tackle this problem of collection of data, analysis of data, or working with low data, working with absence of data, working with holes in the data. So a lot of companies, a lot of researchers are working in this, and obviously, AI is being used to analyze and do predictive analysis that helps in better decision making in healthcare. Blockchain technology is being used so that patients can authorize who can see their data, can give confidentially data information. And obviously, other technologies are being designed for data management. So, if you conclude whatever we have discussed in this last 10, 12 slides, we can see that the healthcare data is important. There are challenges in healthcare management, And addressing this challenge will maximize the benefits to patients and reduce the cost to the companies who are providing healthcare services. We need to, that's why we need to invest in the technology, and we have to enhance the interoperability of this data. So, uh, we need to, when we are working with the healthcare data, we need to define the data that is needed for the project that we are undertaking. We need to develop multi-sector partnership with pharmacies, with healthcare providers, with software provider developers, and so on. And we need to keep in mind the regulations that are current in the healthcare data sharing. So with this, we need to come to some facts, frequently asked questions. So we'll just quickly go through this. So this is basically the culmination of whatever we have discussed till now. What type of healthcare data are commonly used in medical research? So the data sets come from variety of data sources. The most common ones are patient data from hospitals and primary care administrators. Uh, Research which is done on the well-being of populations, or specific things um, like cancers, or so NGOs which are working in this area. Then there is genetic information. Then there are images like X-rays, MRIs, and so on. Wearable devices, which gives a lot of information. Uh, date. So I think there is this cut and paste thing that has happened. But yeah, so these are the basic things that comes from. The rest of the things are repetitions of the above. Uh, then what are the standards for managing different types of healthcare data? So there are various different standards, so like more than 40 different standards only in the US. And then obviously, uh, so many people are developing different standards for collecting and analyzing this data. But basically, they can be categorized into four major groups. So, what is the terminology standards? Which terminologies you should use? So, like for example, cancer can be termed as melanoma. So, what do you use? Right? How do you standardize the terminology? How do you try to standardize the severity? How do you standardize the spread? So there might be terminology standards. Then there might be content standards. There might be data exchange and transport standards, right? So how do you do data exchange between things? Then there are privacy and security standards. How do you ensure the privacy? So it should be common across all. Security should be common across all, and so on. So all of these standards are being developed, and there is a lot of work that has been happened in defining the standards, in sharing these standards, in making those standards more comprehensive and simple to use. Softwares can be developed around these standards. uh, so we have seen that what are the standards formats that the healthcare data is available in. We have structured data where everything is well organized. We have unstructured data, free text or images, and so most of the data is medical data is available in unstructured format, which is it poses challenges for consolidation and cost system comparisons and sharing and so on. So some unstructured data can be processed. We get semi-structured data. Some of the things can be put in the structured data, but other things remain as images and so on. And there is a lot of AI thing that is happening to process those images or unstructured data to assimilate and find one single information so that we are able to get more meaningful insight into this analysis. So these are some of the references. I have come to my end of my talk, where we talked about the importance of data, the type of data, the way of data collection, importance of privacy security, interoperability, and so on. So, and these are some of the references. And with this, I end my presentation. And we have left about 15 minutes for the question answers. So I will open up the session for question answers. So you're welcome to ask the questions. Yeah. Any questions? Yeah. So I'm open for any questions. So there were few hands that had raised in between. We can take the questions now.
Participants can type your question in group chat box.
Yes, dear participant. Hello. Yes, dear participant, is there any doubt
Okay.
or any query you can ask to the sir? Sir, few questions in the chat box.
Yes. So I was just reading that. So there are three questions I'm seeing now.
Yeah.
So the first question is how electrocardiogram images data can be analyzed. The second is natural language processing helpful in healthcare. And what pre-processing steps are typically required for healthcare data set before training ML models? Okay. So, mm, uh, so image data nowadays typically can be analyzed with the deep learning models. Okay. So there are many deep learning models. So for example, YOLO can be used, one of the very popular models for image processing that can be used for processing the electrocardiogram images or even the healthcare data sets. Uh, sorry, the um, so a lot of this image processing can be done with YOLO or other things, and but the data needs to be labeled. That is the whole problem. So the problem is that you need to have like tons of labeled data, at least 1,000 or so images. And once those data can be labeled, this image processing deep learning models can actually figure out how to or what can be done with those. And or you can write your own using the Python libraries. You can create your own CNN models, which can analyze the images. And we have seen that these are very effective in identifying the problems or identifying the issues in uh, the data. And then coming to the natural language processing, what we see is that natural language processing is now can be again superseded with the deep learning models. So what we see is that the now Chat GPT or Gemini or such models allow for API based testing. So we can actually take the text data, load this. Again, these are all deep learning models. Basically, the transformer model is nothing but that these all these things use all this chat GPT or Gemini or any LLM uses is nothing but a deep learning model. So a modified deep learning model. So you can use these models to analyze instead of doing natural language processing now, because natural language processing is now superseded by these large language models. So we are not looking for any engrams or other things. We can directly use the APIs provided by Cloud or Gemini or say ChatGPT to load our textual data and have a conversation with it. Okay, so there is a more method of fine tuning these models with our own data sets. So that can be used to analyze the textual data in healthcare. Okay. Um, then coming to what kind of pre-processing steps are required. So obviously, what we have seen with healthcare data is two things. One is that there is lot of data values that are missing or not recorded during the time that they should be recorded. So missing values is a big problem in data analysis for data sets. So how do you basically fill those missing values? Should you put some random values there, or should you put some base values there, or should you extrapolate these values from other data sets? So that is a big challenge, and there is a lot of research, statistical research that has happened in how to fill this, how to fill the null values in healthcare data sets. So that is something that is that requires to be done. So we need to do a lot of pre-processing of healthcare data. Null values needs to be removed. That is the very first thing. And then second thing is that many a times we see data values that are out of range. So instead of someone typing say a BP of 99, it becomes 999. So 999 is a huge value, but it was just an operator mistake because that operator was just putting in values instead of putting two things, he put in three things. So these kind of outliers are also significant in healthcare data, and that these outliers actually, if you try to find out the average BP of all persons, these outliers will skew it to some values. So how you will need to basically find out those outliers and normalize them. So a lot of data pre-processing, and this has to be done manually for every decision. And before we can use ML models on that healthcare data set. So pre-processing is a huge step, and it will actually consume 80% of your time, and 20% is just required for analyzing and getting results. So pre-processing is the main, we can say, pain point as far as the medical data is concerned. How do we ensure privacy for medical data collection? So if you go to any hospital, say GMC or AIMS or any hospital, and try to collaborate with them, so they have an ethics committee in which you have to give the your project proposal, and that project proposal will have what kind of data you require, how do you ensure the privacy of data, security of that data, so that data is stored, it is anonymized, how it will be anonymized, how it will be encrypted, how it will be used, what kind of hypothesis you are proposing, like what you are planning to do with this data, what kind of thesis or hypothesis is planned, and what kind of analysis and insight that we will get. So all needs to be documented, and all procedures need to be documented, and you have to prove that this data would be secure, this data will be anonymized, this data will be encrypted. Even if this data falls into someone's hand, nobody can basically reverse engineer it and find out about the patient's their personal data, their Aadhaar card, their name, their addresses, their age is not revealed. So, so this has to be proven before the ethics committee, and only then you can collaborate with any medical institution. So, so you have to make a project plan where all these things are inbuilt. You have thought about all these things. That has to be there, and only then we see that they allow you to share data or get data from their institution. So another question is what kind of real-time data we can get in the healthcare domain. So most of the real-time data is basically different kinds of machines that are attached, especially in the we can say ICU or ICCU. So that real-time data is always collected. Also, there are many devices like the phones or wearable devices that collect the real-time data. But obviously, this real-time data has to be uploaded to certain websites, and only then from the cloud we can access that real-time data, which that step is typically missing. So real-time data, getting a real-time data is very difficult, especially in large numbers. Uh, but if someone allows you to access their data, then only you can get that. So ML pipelining in patient EHR. So electronic health records itself are difficult to get, and if you get that, then obviously you can do ML analysis of that. But getting that is very very difficult, and yeah. So I think I have tried to answer as many questions I can read and understand and analyze. So obviously, I'm electronic health records or so this biological data is huge in amount, and I'm not expert in everything. What I have worked typically is in analyzing the genomic data, and in genomic data we are able to find out a lot of anomalies in genes, and how genes basically once get activated can affect a certain number of proteins, which basically affect the cell, which basically demonstrate a particular behavior of a person. So that itself, we were able to get some patents and some papers and publications around that. So this gene database is available at various places. So there are many European repositories, Canadian repositories, US repositories where this gene-based data is available, and also Kaggle databases. So there are many biological databases available on Kaggle datasets. So those can be downloaded and analyzed. And obviously, image processing is a very different domain. String processing, the DNA gene processing requires a lot of string algorithms. So that is a very different domain. Then image processing requires deep learning. That is a different domain. And natural language processing or text processing, it can be done now effectively. Earlier, there were not of natural language processing techniques, but nowadays, a lot of this chat GPT and so LLMs are able to do a lot of very good text processing algorithms, can be implemented using or use APIs can be used. Their APIs can be used to analyze natural languages. So text data. So a lot of advancement has happened, and because of which a lot of new things have come up. The interesting thing is like how do you use these LLMs to analyze images with text and do some hypothesis testing. So that is something that is a research area, and I hope people might find it interesting to use it for their research. Even comments on various websites like Amazon, Flipkart, or 1mg or NetMeds, how you can collect data for a particular disease or a particular medicine and analyze that and give predictions of where it works, where it doesn't work. So these are all very interesting research problems. And I will suggest some of you to kind of uh, use this so that you are able to analyze the data, write some papers, create patents, and present it in some conferences. Uh, so, which way we ensure data integrity in healthcare data? So, data integrity is again, I told you, like it's a huge problem, and we require people who need to go through the data to figure out that the data is consistent, complete, and has all the fields, then no null values, and so on. So a lot of investment needs to be done, and also that person needs to be informative from the medical domain itself, uh, who can analyze that or who can basically guarantee that this data satisfies all these requirements. So a lot of cost is involved in making sure that the data integrity is there. Yeah. So this is all, I think, the questions that I could see and answer. So thanks a lot to everyone for joining and asking questions and making it a very nice presentation. Uh, I'm really thankful to the team of ATAL this sessions who allowed me and invited me to this conference, to these sessions. So thank you everyone.
Thank
Thank
you.
you.
Thank you, sir, for sharing your expertise with us. Your lecture was highly informative and helpful. It was incredibly enlightening, sir. Thank you so much, sir.
So I have shared my slides with the organizers. So feel free to share it with all the participants.
Okay, sir. Thank you so much, sir.
So thanks a lot, and I think we can now drop off, right?
Yes, sir. Sure, sir.
Yeah. Thank you very much. I will now sign. Thank you.
With this, we come to the end of our first session. Thank you all for your participation. We invite you to remain online as our second session will begin soon.